This is part 2 of a 2-part presentation.
Thank you. I'd now like you to outline for us the conscious competence learning model.
The conscious competence learning model is to do with the psychomotor skills domain, and you start off with unconscious incompetence, and we're talking about how we acquire a new skill. So with unconscious incompetence, the learner is unaware of his or her lack of a particular skill. That leads to conscious incompetence. The learner now realizes the importance of a skill but fails in trying to do it. That leads to conscious competence. The learner through practice can now do the skill but has to think about each step. And conscious competence then leads to unconscious competence, where the learner can do the skill effortlessly without much conscious thought, and we're talking about mastery.
Can you tell me about the Johari window?
So the Johari window can be used to evaluate what are the learning needs of a learner, and there'll be learning needs which are known to the learner and which are known to others, and that's in the top left-hand column. There'll be learning needs which are not known to the learner but are known to others, and that's the blind area. And by feedback, that area gets less. There will be learning needs which are known to the learner but are not known to the teacher, and that's a hidden area. And by disclosure, that area can get less, and that's the bottom left-hand column. And the bottom right-hand box is learning needs which are known neither to the learner nor by the teacher.
Thank you. And what is Miller's prism of clinical competence?
Miller's prism of clinical competence starts off with the base, which is knows. That leads to knows how. That leads to shows, and that leads to does. So knows and knows how is all to do with cognition, and shows and does is to do with behaviour. So knows is sort of fact gathering. So a learner can demonstrate that they know something by doing a traditional true-false MCQ. The next stage is knows how, and that's still in cognition. That's interpretation stroke application, and the learner can show that they know how through case presentations, through essays, through extended matching type MCQs. So those two were cognition. We then go on to behaviour, and the first one is shows, and that is demonstrated by the demonstration of learning, e.g. by simulations and OSCEs. And the top of the pyramid is the does, which is also behaviour, which is performance integrated into practice, and that's e.g. through direct observation and workplace-based assessment. So that's Miller's pyramid, and PRISM is if you take into account attitudes, skills and knowledge for all four of those areas. And as they go from knows to does, they go from a novice to an expert.
Thank you. And finally, what are Gagné's 9 events of instruction?
These are a guide on how to deliver any educational session. 1. Gain attention of your learners. This is to create a state of readiness in your learners for learning. Examples of how you might do this include an analogy, anecdote, paradox or article. You really need to hook them firmly before any educational session to ensure they engage. 2. State the session's objectives. Provide an outline of your session's plan in a visual form, e.g. a mind map or diagram, so they can see where you are going and what to expect. It also provides a framework onto which they can hang new learning. It can also create powerful expectations via your objectives, which will hopefully hook them further. 3. Stimulate recall of prior learning. Start off from a level playing field and establish what they already know, so that they can use that as a springboard for new learning and weave it into any new learning. 4. Highlight key features. Emphasize the key messages in your session and signpost them in a variety of ways, e.g. through pictures, sound, etc. This will maintain attention and aid recall. Number 5, structure the learning. Break the learning into small, manageable chunks, always starting from the simple and gradually moving to the more complex. Check understanding periodically and be prepared to go back a step if there is any difficulty. 6. Encourage activity. Encourage learners to question, discuss and demonstrate. Help them create links and associations. This will A. tell you to what level they are learning from your session. B. Enable you to correct where necessary. C. Promote understanding. And D. Maintain attention through active participation. And the 3 remaining areas are provide feedback, assess performance and enhance retention, learner transfer and signalling future learning. So number 7, provide feedback. Once learners are actively involved, reinforce messages if they're on the same wavelength as you, but correct if they are not. 8. Assess performance. Evaluating progress helps you A. check that they have got the gist of what you've been trying to convey, B. to strengthen any learning, and C. to ensure you've done your job well. An evaluation form is just one way of doing this. And number 9, enhance retention, learning transfer and signalling future learning. Summarise the learning that has occurred and then set future homework to ensure the learning is transferred and applied into their real worlds. Good facilitators will arrange a further follow-up session to see how that application has gone, fine-tuning further if necessary.
Thank you. Both Sunil and I would like to thank you for listening, and we hope that you'll listen to some of the other podcasts from the South Essex GP Training website.